oh, there we go, a lot of familiar names as well as some new names. I am Erica Cochran. I'm here with Claire Relton, who she and I and a third person, Megan Murison, who's not able to be here, facilitated this learning initiative. This is one of a number of conservation measures partnership learning initiatives that were supported by the Gordon and Betty Moore Foundation. And in particular, our initiative was a 2-year learning initiative around population health and environment, an integrated approach to conservation. We've also called this, instead of population health and environment, we've also called it the integrated conservation and reproductive health. So before we get started, Claire and I just wanted to quickly introduce ourselves. We will also be introducing David Johnson a little bit later in the presentation. But my name is Erica Cochran. I work at the International Crane Foundation, a mid-sized conservation organization that works to protect cranes and particularly the ecosystems that they depend on, the wetland and grassland ecosystems, for not only their benefit, but also for the benefit of other species, and particularly the human communities that also depend on those wetland and grassland ecosystems. We work, I'm based in Wisconsin in the Midwest of the United States, but our organization works across Africa, Asia, and North America. So I also serve on the board of directors for the Conservation Measures Partnership and am a coach associated with the Conservation Coaches Network. And the reason why I stepped up to help to facilitate this learning initiative is not because I'm an expert in population health and environment, or PHE, but because our organization was just beginning our first ever integrated conservation and health approach, together with the Margaret Pike Trust, our major partner who David Johnson is representing. And as an organization, we didn't know much about the approach, and we really needed to learn. So I wanted to help our organization learn by helping to facilitate the learning initiative. And I'll turn it over to Claire.
Hi, I'm Claire Relton. I'm based in the effectiveness team at Darrell Wildlife Conservation Trust. Similar to Erica, I am not an expert in PHE at all, but we have both learned considerable amounts in the last couple of years. And prior to working for Darrell, I was based at the Endangered Wildlife Trust, which sort of co-developed this PHE project up in Uganda. So that project is very special to us, and you will hear a little bit more about that case study during this initiative. Thanks, Erica.
Great. So I'm going to go ahead and launch into our presentation. If you'll advance the slide, Claire. So in this webinar, we want to just briefly go over the learning initiative purpose, the process that we use, the products that were produced, and some of our key or major findings. That I will present, and it will be relatively brief compared to the amount of content that was produced from the Learning Initiative that you can find in our full final reports from 2020 and 2021. Because we want to spend the most of our time together really understanding how you might use, or others in the conservation sector might use, the products, and also having a conversation together with David Johnson about why conservation should consider this approach. And some time for questions and answers. So before we get started, I wanted to make sure that we're all kind of on the same page. This is actually a product from this learning initiative from 2020, was defining population health and environment for the conservation sector. So I will actually read through this so that we're kind of all on the same page, because it's a lot of words. So PHE is a multi-sectoral partnership approach to biodiversity, human health, and sustainable livelihood. So all three of them together in partnership. PHE approaches are developed inclusively and equitably in response to local situations and the expressed needs of the people most closely linked to biodiversity conservation. So it's done with those people. The framework for the program is developed together with with the community. PHE is intended to improve human health, particularly reproductive health, because that is the population part of it, is the reproductive health component, while empowering communities to achieve sustainable livelihoods, manage natural resources, conserve biodiversity, and maintain ecosystem services. So that is the E, or the conservation part of the approach. So that first paragraph is really about what PHE is about, and this next paragraph is more about what we expect from a PHE approach. So by integrating across those multiple sectors, PHE can reach more people linked to biodiversity outcomes. We can engage more men in reproductive health and more women in livelihood and natural resource management. And this is the crux of this work, is PHE can ultimately achieve more significant and longer lasting conservation outcomes than would likely occur without integration. When barriers to family planning are removed and contraceptive needs are met, women and girls can exercise their reproductive rights, leading to healthier timing and spacing of pregnancies, improved health of women and their children, and more time and energy to engage in education, conservation, and livelihood activities. So that's the definition, and you can have that in the back of your mind. Again, this is one of the products that we'll get to as we're going through. We won't read it through it again. So the main purpose for this learning initiative was really to improve the conservation measures partnerships and more broadly the conservation sector's understanding of this approach of population health and environment, or integrated conservation and reproductive health, or similar approaches, and its value to biodiversity conservation, to identify the barriers that prevent uptake of this type of approach, and where PHE is relevant, and where it's relevant to provide tools, examples, recommendations for program design, implementation, and evaluation. So the purpose, because this was a 2-year learning initiative, each year we had a different set of objectives. So in 2020, we really focused on defining PHE for the conservation sector, identifying barriers to wider adoption of this approach where it would be relevant, developing a generic theory of change model. So that those of us who use theories of change can use that for our application. In 2021, we took real-world examples and learned from them, and we used those examples to adapt that generic theory of change model. And we also use those examples to evaluate the evidence towards that generic theory of change. And in both years, we made recommendations and are working to share the learning and the related products within and beyond the conservation sector. So our process was, to get people involved. So as Claire and I mentioned, we were not the PHE experts. We wanted to learn. So we assembled a group of really powerful population health and environment experts from around the globe. And as you can see, there's a lot of names here. And there's a lot of different affiliations. So there's some affiliations with different conservation measures partnership members, as well as others from other sectors. So this truly was a multi-sectoral collaborative learning initiative. Next. So in 2020, our process was we formed this collaborative learning group. We conducted key informant interviews. We conducted also a PHE expert survey. And we, together with that team, through a series of online meetings, we developed that definition for the conservation sector, and we also developed a set of generic theory of change models to show the value of these types of approaches. And finally, together we designed and learned from a conservation measures partnership learning survey that went out to the broader conservation sector. We got 234 responses from people that helped us to understand the knowledge, experience, and barriers to uptake of PHE within the conservation sector. And in 2021, our process was to select cases. So we selected 5 case studies from, I think, 11 submitted potential cases. We interviewed those case study representatives, reviewed background documents, analyzed case study surveys. So we had them complete a survey. And then we assess the differences and similarities between those cases and use those cases to improve and adapt the generic theory of change that was originally developed in 2020. We also use those cases to assess the evidence that the cases were realizing the results laid out in that generic theory of change. We also, as part of 2021, we conducted a number of outreach events. We, being the larger collaborative working group, conducted a number of outreach events that are also documented with some links in our final report from 2021. So our products, this is feels a little redundant to me, but our products kind of follow that process. Sorry, let me get there on my own slide deck. The products from 2021 were really that definition, 2 related theories of change. So one was at a higher level of trying to understand the value of integrating health with conservation. So as opposed to having health and conservation operating as separately in the same area, what is the value of that integration? So that's just at that high level of integrating health with conservation. And then the other theory of change that we'll use a lot later today is specific to a population health and environment approach, or specific to an integrated conservation and reproductive health approach. We also identified barriers to population health and environment. Back one. We identified barriers, and then we made some recommendations. Okay, now you can go to 21. In 21, we developed 3 case-specific theories of change. So we really went into depth in 3 of the 5 cases. We also revised that theory of change based on the 5 cases and provided evidence towards the results in that theory of change based on the 5 cases. We also identified potential indicators. There's indicators in the 3 case-specific theories of change and also generic indicators in the generic theory of change. And then we developed a final report with recommendations and that outreach plan with links to recorded webinars. Part of our 2021 products were these 3 case-specific theories of change. So I just wanted to let you know that one was from Madagascar, one from Uganda, and one from Ethiopia. And these represent a very broad, a very different set of projects or PHE programs at very different scales, at different biodiversity focus, and completely different contexts. So they're a really nice assemblage of cases. Now I'm just going to quickly identify some of our major findings, just so that you can understand what came out of the learning before we really delve into some of those products. So this is really at a high level. So from 2021, our findings really focused around understanding the value of the value of PHE and the barriers to uptake. So from 2021, our findings were really agreement that there was an agreement that PHE is a valuable approach to conservation in some contexts, and that there was a broad desire to see a greater uptake of PHE approaches. And this was both from both of the surveys that we did. So from the expert survey as well as that broader conservation sector survey, there was this general agreement around the value and the need for greater uptake. So that led us to really investigating the barriers, and the biggest barriers to adoption that we saw was a lack of awareness of what PHE is and understanding its value, how PHE works. So hopefully this learning initiative is addressing that barrier. Then there was also a lack of organizational experience. And a huge barrier is a lack of the necessary funding. there's also a barrier around increased costs for the complexity of working in integration with other partners. So the factors that supported adoption included having a staff champion, ideally somebody with experience, but at least somebody who's really bought into the approach and is committed to it. A willing and able health partner on the part of the conservation sector, and dedicated funding. So this is funding not just dedicated to having health and conservation working in the same area or having some livelihood support working in the same area, but it's really about the dedicated funding for that integration and the additional needs associated with integrating across those sectors, as well as enough funding for the startup and for continuing the approach to the point where you're actually finding and seeing results, as well as existing trust. So the places where there already was some trust with the implementing partners, or at least one of the implementing partners, and experience with working together with the partner and the community, that was very helpful. In 21, our findings were really focused around the evidence that the cases brought to bear. So there was, and when Claire goes into the products, there's ways to find this evidence in the products along the theory of change. But I'm just doing a high-level review of some of those findings. So there's strong evidence that integrating the conservation and health actions increased the stakeholder reach. So it allowed the conservation entity to reach more of the community that we needed to reach. There's also strong evidence that integrating health with conservation action led to greater trust of the implementing partners, and that led to greater involvement in the natural resource management actions. There's also strong evidence that adding a health component and reducing barriers to family planning as part of that health component led to improved family health. And that's kind of like, of course it did. But then that improved family health led to more time, energy, and self-efficacy, particularly on the part of women. There's also strong evidence that the integration of health and conservation action led to greater women involvement in natural resource management actions, even before the improved family health was taking place. Now, this next slide, we're continuing with those same 2021 findings, and there's some mixed evidence. So there's some evidence that it was happening in some cases, some evidence that maybe there wasn't enough time, and some evidence that it wasn't really happening or wasn't happening yet. That increased involvement in natural resource management and increased uptake of livelihoods actually leads to some of those ultimate outcomes of reduced pressure on the natural resources. There is also mixed evidence that communities and partners sustain those natural resource management and livelihood actions in the absence of direct intervention by the conservation entity. And there's some negative evidence that with that increased time, energy, and self-efficacy that comes with improved health, and some of the gender inclusive work, that can lead to environmentally unsustainable actions. So that time and energy can be put into unsustainable actions. However, there was also evidence that with attention to livelihood support and community governance, that this risk of increasing unsustainable actions can be minimized. Okay, those were our major findings. And I hope that this is a really brief overview of the products, the findings, and our process. There's a lot more detail in our final reports, but I hope it's enough for you to be interested in learning more about the products and how you might use them and apply them to your own work or help others to apply them. So with that, I'm going to turn it over to Claire, who's going to delve a little bit more deeply into those products and how you can use them.
Thanks, Erica. So, firstly, it's just now my dogs have started barking, very exciting, sorry about that. So all of these resources are available to you on the Conservation Measures Partnership workspace. So if you wouldn't mind, Sarah, just popping that link into the chat so everyone can have access to it. So through the workspace, you can download resources from 2020 and 2021. So our final reports are available for you there. And in those final reports, you'll have access to those theories of change and the descriptions. You'll be able to investigate more deeply those real world case study examples. So there are case study specific theories of change. You'll be able to look at our our curated set of resources. So we sourced resources, documents, scientific papers from all of our PHE experts, and there are a huge amount of resources within that library that you'll be able to download and source from. So if you're wanting to learn more about PHE, there are loads of resources available to you. You'll also be able to view this webinar recording as well as our webinar that we conducted in March 2021. So I'm just going to jump out of here and hopefully you can still see my screen. Our resources are within the human well-being section in the CMP workspace. So if you just scroll down, you'll be able to see integrated reproductive health and conservation. So this slide deck over here is our 2021 final document. It's got about 73 slides. It's got loads of details and resources in it. It looks like this. So the link is also in the chat for you. So you'll be able to go through this, and it's got all of our methodologies, findings, and all of the products that we developed. Similarly, the final document from 2020 is also there available for you to download. You scroll down, up here is a little link to our case study. So you'll be able to click that button and then you'll be able to read through the case study examples. So those real world PHE projects, all of the detail and documentation associated with those products is available in that case study box. This is our webinar recording from last year. And then if you click on this curated list of resources, you'll be taken to this Google Drive space where there are a huge number of scientific papers, as I mentioned, reports and documents that will help you learn from other PHE examples and some guidance documents associated with how you might implement a PHE approach like this. So just jumping back into the slide deck here. All of these, well, similarly, these resources are available for you in CAML. So CAML is the Conservation Actions and Measures Library. It's an open source library, a shared platform on Marathi Share. So it is in the shared resources folder in Marathi Share, and you are able to download both the generic theories of change that we developed, as well as those case-specific examples. So if you are wanting to learn more about a PHE project, if you want to advocate for PHE use within your organization or to your donors, if you're starting out with a PHE project and are looking for measures of success or potential objectives or an example of what a theory of change or a results chain might look like for this type of project, you can download that and you can adapt it for your use. Also, if you've already running a PHE project and you'd like to compare the results from your project with that of other real world case studies, you can go into CAML and you can have a look at some of these. So let me just jump in to CAML. This is what it looks like in CAML. You'll notice it's in that shared resources folder. So if I scroll down, you'll be able to see there are 3 high-level generic results chains in there, and associated with those are the indicators. So you can click on these indicators and you can look at what indicators we've included in the high-level generic results chain, as well as within these case-specific examples. So there might be some additional details underlying some of these strategies and these result boxes. There are also ways that you are able to view the evidence that Erica spoke about. So there's evidence linked to each of our assumptions within our generic theory of change.
Claire, do you want to enlarge, do the full screen?
Sure. There we go. So if you're running through this theory of change, you'll be able to see we captured that evidence within the results progress tab in Marathi Share. So you can click on that. that particular little result progress, and you can read through what evidence we found for each of our 5 case studies. So how many of our case studies validated that particular assumption along the theory of change, where there was some evidence. So I'll just show you the key up here. So where all 5 case studies validated that particular assumption, we marked it as dark green. If some, so most of those cases that verified that assumption, was light green. If there was a bit of contradictory evidence associated with that assumption, we used yellow. If all of the cases contradicted a particular assumption, it was red. You'll notice there are no red results within this box. So the vast majority of them are, at least some of our cases validated the assumptions that we made along this generic theory of change. If you go into the case-specific examples, you'll also be able to see the evidence associated with the assumptions for each of those case-specific examples. All right, so that is Maradi share. Let me jump back into the presentation here. I'm just going to go through the theory of change in a little more detail, that specific high-level generic theory of change I spoke about. So the strategy here, or the action here, is integrating reproductive health and family planning into conservation action. So it's a PHE approach because it's got both a sort of health, reproductive health component, as well as that conservation element. So our desired ultimate outcomes here are to reduce threats to biodiversity, obviously, while ensuring that natural resources are being sustainably managed. We want biodiversity to be conserved, those ecosystem services to be maintained. And simultaneously, this approach aims to improve human health, particularly reproductive health. And we wanted to achieve more sort of sustainable and resilient livelihoods for those local people. In order to achieve this, we were starting out with some enabling conditions that we needed to be in place right from the beginning. So we needed there to be a direct linkage between human health and the health of the environment. And in most cases, there is. So communities are generally directly dependent on their natural resources and the ecosystem services that they provide. So we needed this to be in place. We needed willing and able partners with the relevant experience and expertise to be available. We needed there to be community engagement in things like natural resource management and conservation action. But in most cases, this would be limited by the fact that there was this need for basic human and reproductive health. So because they wanted to engage in conservation, or they wanted to engage in natural resource management, but they couldn't because there was this issue with human health and reproductive health. This was an important component that we needed within these enabling conditions. And importantly, we wanted the government and policy and funding support for those desired outcomes to be secured. So if these enabling conditions are in place, then we want to, we basically want to develop this partnership with health and conservation and other relevant partners that might exist within the context of that project. This partnership is really important. It allows for components of integrated and inclusive action, sort of facilitating the delivery of these integrated messages and integrated services that hopefully then lead to this wider reach and a more targeted audience than would be possible if you had sort of single sector approaches. Next up, sorry, I lost my mouse. There we go. Next up, if we have this partnership established and if we have this integrated and inclusive messaging, hopefully we want those program components to be defined by the community needs. So ideally, that initial stage is to make sure that the community actually needs reproductive health and family planning, and they have bought into this. They also in this case, we were suggesting that they might have a need for diversified livelihoods or natural resource management in order to enhance resilience. And those things we wanted them to be identified by the community as a priority need for them, as opposed to being identified by us as conservationists or through the social sector. Next up, an important part is to reduce or remove these barriers that might exist, either barriers to the access in terms of health and family planning options, as well as barriers to the involvement in livelihood or natural resource management. So importantly, we needed to make sure that they had access to these services or the equipment necessary or whatever they might need. So we were removing all of those barriers in order to achieve sort of greater use of family planning and health services. And this will come through some supporting strategies. So our supporting strategies are identified with green text. So we've got a couple of supporting strategies here: education, outreach, and communication, gender equity, and empowerment. So we might have some enabling or supporting strategies coming in to help us achieve these desired results. Different project contexts might have different supporting strategies or different project elements. So just take a note of the fact that these don't always have to be the same. So if we have improved use of these family health services, hopefully that then leads to this healthier timing and spacing of pregnancies, which leads to improved family health, women having more time and energy, as Erica spoke about. And then ideally, if that happens, we would hope to see that families are investing more time in those sustainable livelihood activities or natural resource management. In red text here, we identified some undesired pathways that we don't want to see happen. So importantly, we identified these so that we can address these issues if they do crop up, and we can ensure that there are supporting strategies in place to prevent the undesired pathway here of having more time and energy to then engage in more unsustainable practices. So this is what we hope not to happen. But hopefully, if we have these supporting conservation strategies coming in, hopefully this greater time and energy leads to involvement in sustainable natural resource management, which then hopefully helps support more sustainable and resilient environments, which leads both to a biodiversity and a health benefit. And finally, right at the top here, we've got a little bit of uncertainty about whether healthier families and healthier timing of spacing of pregnancies does result in that long-term decline in the fertility rate. Additionally, any sort of decline in fertility rate may not necessarily result in a decline in the demand for resources. So these particular results were identified by these dotted lines because there was some element of uncertainty amongst these. Right, and then just down here on the bottom, we've got hopefully success leads to increased impact. So ideally, we want to see a bit of scale up amongst these projects. So we want to see a project working sustainably in a particular area, and hopefully more people want to get involved and we can scale up and utilize this approach elsewhere. So this theory of change has all that documented evidence that I spoke about when I showed you the examples in Maradi Share. So you'll be able to see in each of those where we had those case-specific case projects providing evidence for the assumptions that we made along this theory of change. So next question is why we should consider this type of approach in conservation and why we are advocating for an approach like this. One of the things that Erica spoke about in the definition was this value of integration. So if one sector's actions lead to one sector's outcomes and two sectors' actions working in parallel but not working together might lead to two sectors' outcomes, what we are suggesting is that integration can ultimately lead to more than two sectors' outcomes. So if you're working together Ultimately, we want to see sort of more significant and longer lasting conservation outcomes than would occur without integration. So if these two sectors were working separately, as opposed to this multidisciplined approach. So in our initiative and through our case study examples, we found evidence for a number of these components advocating for the value of integration. So things like wider reach, we found that more members of the community and portions of those community were reached through compared to a single sector approach. So we found we were able to reach more people, we were able to increase outreach. So more communities were reached through our outreach initiatives because we were able to link up with various sort of community activities that might already have been taking place and link up with sort of community groups that might already have been established. It helped to increase opportunities for involvement of both men and women. So often it's only women that are targeted in the reproductive health side of things and only men that are targeted in this natural resource management. If we work together, hopefully we can target both men and both women in both of these approaches, which is really, really great. Ideally, it leads to increased knowledge of the connections between human health and environmental health. Ideally, it improves attitudes, so we would see increased support for the project implementing organizations and messages leading to sort of increased involvement in those environmental solutions. Improved health was found, so this freed up time for women to engage in more natural resource management and livelihood actions. And of course, we found that it sort of maximized time available, because if you're offering events at the same time as opposed to separately, hopefully you can then have more community members involved and investing time in natural resource management and these reproductive health initiatives. So I'm going to be handing over to David Johnson now. He's going to give us some perceptions from the reproductive health sector. David is the Chief Executive at the Margaret Pike Trust. For over 50 years, the Margaret Pike Trust has been a leader in contraception and reproductive health, providing doctors and nurses and healthcare professionals with some of the broadest range of contraception and sexual health training options. So David, I'm going to be handing over to you, and the question for you here is, from your perspective or from the social sector's perspective, why should conservationists consider this type of approach, and why might it be of value to conservation?
Thank you. Firstly, though, I must thank you for including both me, the Margaret Pike Trust, and my colleagues in this process. We think it's been really valuable. And it's actually been really enjoyable. The fact that we've actually enjoyed working on theories of change is perhaps somewhat of a surprise. But now, going back to your question, I'm going to break it down into three different sections. So I'm going to start off by sort of talking about from a global perspective of why conservationists should consider this approach. Then I'll go down to a more project perspective, and I'll focus on our project that obviously has a theory of change you've just been speaking about, and then conclude on sort of the value to conservation. Now, throughout this, I'm going to be using the phrase barriers to family planning a lot. A lot of people on this call will know what I mean by that, but for those that are less familiar, all I'm talking about are the obstacles for women and girls being able to use the contraceptive services that they would like to use. Maybe that's fear of side effects or myths and misconceptions, lack of services that aren't youth friendly, so to put younger women off, etc. Anything that stops someone using services that they would like to use is a barrier to family planning. So the first point was sort of looking at this from a global perspective. Now, the Sustainable Development Goals call for universal access to sexual reproductive health services, including family planning. So very simply, this is a global priority to remove these barriers to family planning. And we all know that we can't reach any of the Sustainable Development Goals if we don't reach all of them. So very simply, doing this is the right thing to do. And if there's one message to take home, it's that this is the right thing to do. Because when we remove barriers to family planning, we're able to reduce infant and maternal deaths and many other negative health outcomes as well, whether that's low birth weight babies or stillborn babies or unhealthily timed and spaced pregnancies. If we remove barriers to family planning, we're able to lessen all of those negative outcomes. But then why else is it the right thing to do? Well, because around 257 million women who would like to avoid pregnancy are not currently using safe modern methods of contraception. 257 million women. And that leads on to around 121 million unintended pregnancies around the world per year. A lot of conservationists will think of demographic issues in terms of biodiversity conservation and PHE projects. So I suppose keep that in mind as I just mention a couple of other figures. So if we have 121 million unintended pregnancies a year, very many of those will be, whilst unintended, will lead on to a happy event, a wanted pregnancy, even if unintended. But that's not always the case, because 60% of unintended pregnancies around the world lead to an abortion, and 45% of those abortions are unsafe. So we obviously would like to avoid all of these negative outcomes. But also when you have girls having an unintended pregnancy, that can lead to them dropping out of school. And then that is other negative lifelong outcomes that can result. So if we are to have healthy, empowered women and families and communities, we need to remove barriers to family planning. So in summary, it's the right thing to do. It's 2022. Conservationists need to think of broader issues of health and well-being issues, and remember that it is a fundamental human right to be able to determine the number of children you have. So there's the global perspective. The second point I'll go on to is then, so why should conservationists consider this more from a project level? One thing I was really pleased to hear both Claire and Erica mention that was something that was pleasing in this learning initiative that we went through was how conservation practitioners were so quick to pick up on the importance of the language and the way we talk about this topic. So everybody agrees that barriers to family planning are wrong wherever they are in the world, but we also know that they're not always relevant to biodiversity conservation. We're not saying that PHE projects are a cure-all to all conservation challenges, but sometimes they are. And when they are relevant, then they need to be considered. So our project site that both the previous speakers have referred to, the average number of children per mother in the area is 8. And the average number of children that they would like to have is 6. So therefore, people are having 2 more children than they would actually choose to have, but for these barriers to family planning. And the decision to have, or the desire to have 6 children is before some of the other issues are addressed. So there's a real lack of information and education about myths and misconceptions. So if we were further advanced in this project, we assume that number would also reduce when other things were responded to. But there is a significant difference between desired family size and actual family size, and that's because of the barriers to family planning. So that's why we should consider it. So as part of our project, Ugandan colleagues that were researchers spent 6 months undertaking a really extensive ethnographic research project within the communities. And they were tasked with talking to the communities to try and understand how they perceived their livelihood, environmental and health challenges. And the message came back from the communities loud and clear that whilst policymakers might not necessarily see the connections between these issues, the community did. So the community were very, very aware of the impact of climate change on them today. They were very aware of how rainfall patterns and was impacting soil fertility and various other agricultural activities. They were very aware, obviously, of the limited range of livelihoods that were on offer and how the poor health of local ecosystems was impacting their livelihoods. But then the thing that was particularly interesting from us was the extent to which the communities we were working with and for were reporting that they're having larger families than they would like to have, And the challenge that they see why that's most relevant is because culturally, families want to leave their land to their children, which is subdivided. And they can see that as the land is progressively subdivided into smaller and smaller sections, they know that they're passing on an insufficient amount of land to their children for their children be able to farm. So on the one hand, they wanted a greater variety of livelihood opportunities. They needed livelihood opportunities which needed less land, and they were calling for health services, including family planning services, so they were able to have the desired family sites. So in the specific context of Ruchiga in southwest Uganda, where we're working with the International Crane Foundation and Rugarama Hospital, the community were calling for this. So why should conservationists consider this at the project site level? Well, because when the community call for it, it's really essential that we obviously pay attention to that. I think there's obviously a lot of talk about demography, understandably, but I suppose maybe one of the take-home messages is to consider in the very long term whether some traditional conservation projects could possibly be successful if we ignore the demographic realities and the health needs and wants of local communities. So the third and final sort of section of my answer to Claire's question is, what's the value to conservation? Well, if the community have asked for something, we should deliver it. And now this can lead on to a goodwill effect. And we're actually already seeing this in our project. So our health partner, Rugarama Hospital, is based in the local town and undertakes outreach into this rural area where the wetlands are under pressure, where there's insufficient health services, and where there are the cranes. Now, the International Crane Foundation hadn't worked in this area previously, and Rugarama Hospital was seen as the real gold standard locally of healthcare services. It was the service provider that's seen as providing better health services than the government facilities. And the funding that we received to enable this project meant that we could go with this, the flagship preferred health provider. And the International Crane Foundation, in their work in the communities, of course, has been able to associate themselves with the local health partner that's really, really well respected, more respected than the government. They're also able to say that we undertook this 6 months research on what you perceive to be your challenges and your desires of how we could help. And of course, you said that you want better healthcare services. And we've actually partnered with a hospital to ensure that happened. You can well imagine that many people lacking livelihood opportunities might be less concerned about nesting crane numbers rather than healthcare services. But of course, now ICF is directly associated with the provider of the healthcare services. So there's that real goodwill effect that demonstrates conservationists are genuinely interested in people. Claire's referred to this in the sense of the generic theories of change of accessing more men with health messages and more women with the livelihood messages. Now, we're just doing this absolutely everywhere. So whether it's when the hospital are mobilizing in churches that the clinics are open on certain days, they are also referring to livelihood issues, environmental issues, and vice versa. So we're able to get conservation messages down far more avenues than if ICF had been working alone. And our project, kind of the headline of it, is that we're seeking to establish the conditions that are necessary to enable long-term conservation of cranes and healthier wetlands to benefit human health and the livelihoods that depend on them. But the level of other benefits is that we are actually finding cost savings. The International Crane Foundation's project office is rent-free within the hospital. We have a shared project vehicle. There are greater number of partnerships that are possible because of even with government departments, because of the hospital and the conservation partner. And the project was deemed to be the most interesting of the current round of Darwin Initiative projects. So we were selected for a midterm review, and this might be something actually that Claire and Erica don't actually know. Well, I'm sure they know that the midterm review from the UK government donor was exceptionally positive. But one of the things they brought out was also that by looking at this from a real systemic basis, we'd had some unintended consequences, which is the sort of thing that Claire will be desperate to put onto a theory of change. But the unintended consequence that the donor came up with was that because of the increased extent of engagement with community members, we've had a positive impact on Sitatunga numbers. So they said that Sitatunga, an antelope species that lives in the wetlands, are locally endangered, and there was only 10 or 11 believed to be in the area, and that their strong assumption that was this systemic approach of the project should actually lead to a reduction in poaching and an increase in Sitatunga. So why should, my final point was like, what the value to conservation? Well, we believe that in the context of the project site being a potential plausible PHE site, we believe that there will be greater human health and biodiversity outcomes and gender outcomes than had either sector worked alone.
Thank you, David. It's always great to hear from our partner in Uganda and hear about the great work. I was just there recently working with that team, and can verify a lot of the positive goodwill, the increased reach, a lot of the things that we've talked about. We have only a few minutes left. We have 8 minutes left, and I wanted to make sure that we were able to answer some of the questions that you all have. Sarah, can you help us navigate that?
Yes, absolutely. So the first question we have is, could you summarize or say more about the elements or conditions that can lead to sustainable rather than unsustainable behaviors in this context?
So I'll take a first stab at that, and then I'll turn to David or any of the other PHE experts that are on the call with us. Really, it was about those companion strategies that are around local governance, like land tenure issues, some of the barriers that might be present for the community actually being able to restrict access, as well as the selection and the support for the livelihoods that will lead to the reduction in pressure on the ecosystems. So it's really about that, the selection of those livelihoods and support for them, as well as addressing any barriers. So it might be law enforcement or tenure issues that would need to be addressed, as well as local governance. Anything that you want to add, David or Claire, or anybody else?
I suppose what I would say is that every project site is different. So the sustainability issues are different everywhere. So our project, one of the things ICF's led on, is ensuring that the community conservation groups have had exhaustive training on bookkeeping and marketing and access to markets, not just here are the livelihoods. So they've thought very much to the long term, although also ICF want to work in the area, I believe, for at least the next 10 years. So nobody's running away. What we've been doing is building the capacity of the local hospital and the clinics, which are still going to be there after we've left. So I won't go into the detail of this, but our training methodology is really comprehensive. It has masses of train the trainer elements. There's all sorts of things that are to do with structural issues within health services, so that we also intend to be working in the area for a long time, but nothing has been set up to be a quick fix in our particular project. And I'm sure other PHE implementers will be doing similar things with different livelihoods and different structural issues.
So next comment/question is about the work that the Center for Biodiversity is doing to let people know about the impact of human population growth on biodiversity, and their campaign creating condoms presenting endangered species to pass on the message. Does anyone have any comments or thoughts about how that's been used?
I'll take that. I don't know too much about this, but yes, I suppose what these are maybe two different things, because what the Centre for Biological Diversity is trying to do is engage its sort of followers and people interested in the topic in wealthy countries that are looking at their website or receiving their mailings. So that's part of the process of people becoming aware of the concept. PHE projects aren't actually about trying to get like the mailing list of the Margaret Pike Trust involved. It's actually responding to the community needs in a particular area. So yeah, what the Centre for Biological Diversity is doing is interesting and relevant from a sort of public engagement and policy perspective, whereas PHE is more at the or is only at the project site to the particular needs of that community.
So David, those those condoms that say "can't refrain, remember the whooping crane," those would not be distributed in a PHE project.
No, they absolutely wouldn't. And one thing that we actually haven't said on this talk is that if you're having a PHE project, the International Crane Foundation is never going to provide reproductive health services, just like Ruggerama Hospital and the Margaret Pike Trust are never going to train you how to do a water turbidity test or how to grow whatever the agricultural products are. It's specialists doing different things. And it would be completely unethical and wrong for any health organization ever to have like one method of contraception as condoms. They're not even very efficacious at reducing unintended pregnancy. So it's like there's all sorts of things that our sector would worry about, method mix, etc. So yeah, it's much more complex.
And I think we've got one more question, comment, and then we should sign off.
Yes, absolutely. So thinking back to the era of integrated conservation development projects in the 80s and 90s that had great intentions, but whose results were criticized as having, at best, modest results. This sounds great too, but how is it different?
Well, hopefully this is different because we're going to have greater results. That's the... am I allowed more time in that? Because you're probably trying to close, aren't you? But
no, go ahead, please.
So I think that, as you rightly say, that there have been that this has gone on for decades of acting at a very low level, and we haven't had enough projects, and it hasn't really ever got to scale, and that's part of what CMP is trying to do. So if you don't have very many projects, you can't learn from the actions of the past. We've got the London School of Hygiene and Tropical Medicine that's developed a really robust evaluation framework on our project so that we can really prove that this is all working, and everything appears to be indicating that it is. So I suppose we've been on a journey over decades, and we are gradually increasing the number of projects and increasing the evidence from them, and hopefully learning from the past.
So they're similar. It's maybe just an evolution in improved design and improved implementation based on the learning from the past.
Yeah.
Yeah.
Great. Well, thank you everyone for joining us. This was recorded, so it'll be posted on our YouTube channel in the coming days, and I'll be sending up a follow-up email with the links to the resources that we shared in the chat today as well. But yeah, thank you all for coming, and please let us know if you have any further questions, and we'll be in touch.
Thank you. Nice to see
you all.
Yeah, hi Stella. Nice to see a number of our Learning Initiative participants.
Great.
Thanks for having me.